Welcome to my YouTube channel. So, in aims examination, we can download the hall tickets. Okay, I hope you all know about this. So, I also downloaded the my admit. So, this is my hall ticket number for the hall ticket for the examination. So, I have the Center of Iron Digital Zone in Maulali and civic infrastructure. So that is Hyderabad, Telangana. So on the day of Saturday, 3rd June, and I have the exam in morning. Okay, so please check your hall tickets. Okay, and prepare well. So let's enter into the topic. So the first question is, okay, the first one is identify the skin traction among the following. So, among these four options, which one is the skin traction? Options are Buck's extension traction, Russell's traction, Dunlop's traction, all of the above. So, the right one is option D, all of these. So, these three options are related to the skin traction. Okay, skin traction is nothing but the traction is applied to the skin, that is superficial. And we have another type, that is bone traction. So in this method we connect the traction for the bone. Okay, for example, if it is a bone, it's a long one, maybe it is a tibia, okay, or femur. So wherever the fracture is occurred here, okay, so they will make a hole in this and they will put a rod. So for this rod they will keep a attraction, that is weight. Okay, so this is the bone traction. So these three types are related to the skin traction. So the next question is, spica cast is used for. Options are arm, leg, foot and hip. The right one is option D, hip. Okay, so spica cast is applied for the hip fracture or otherwise hip deformities. The next one is, a patient is scheduled for right total hip replacement surgery. The nurse should teach which of the following post-operative leg position. Options are maintain leg in abduction, maintain legs in adduction, maintain internal leg rotation, maintain less than 90-degree hip flexion. So the right one is option A, maintain leg abduction. So when the patient have the hip replacement surgery, we need to educate the patient for always keep in mind that about the leg abduction. Next one is the surgical procedure done to relieve pressure in compartment syndrome. Options are open reduction with internal fixation, meinsectomy, and fasciotomy, arthroplasty. The right one is option C, fasciotomy. So fasciotomy surgery is, so the fasciotomy is nothing but, firstly, what is fascio? Okay, so fascio is nothing but it is a accumulation of the connective tissue. Okay, accumulation, fascia is a thick sheet of the connective tissue. It is surrounded by the muscle compartment. So muscle compartment is nothing but, so we have a type of muscle here, so we have the another type of muscle over here. Okay, the gap between the two muscles is known as the muscle compartment. So what will happen here, so fascia, it is a kind of pressure on the muscles. So in this procedure the fascia is cut to relieve the pressure in the muscle compartment. So this is the muscle compartment. So we will remove the pressure by removing the fascia. So it is mainly for the acute and chronic compartment syndrome. So it is nothing but compartment syndrome. So in this condition we can go for the fasciotomy. The next question is a nurse is caring for a old lady with osteoarthritis and all the following facts are true regarding osteoarthritis except one. Options are crepitus, toffee, subcutaneous nodule, pain in the moving joints. The right one is option B. Option B is a toffee. So what is the meaning of toffee? Do you know? So tophi is nothing but it is a condition or the clinical feature we can see in the condition of gout. So what is the meaning of gout? Gout is nothing but it is a disease of uric acid deposits. Okay, uric acid deposits in the surface of the joints. Okay, the joint which is present between the two bones. Okay, so here we have the uric acid crystals. So this condition is known as the gout. So in this condition we have the feature of tophi. Tophi is nothing but accumulation or settlement of the uric acid crystals. The next one is carpal tunnel syndrome is caused by compression of. Options are the medial nerve, radial nerve, the ulnar nerve, or the femoral nerve. The right one is option A, median nerve. So median nerve is present at the wrist joint. Okay, so when the pressure on the median nerve, so we have the development of the carpal tunnel syndrome is due to the compression of the medial nerve. The next one is Tinel sign is used for diagnosis of which disease? Options are carpal tunnel syndrome, varicose veins, deep vein thrombosis, none of the above. The right one is option A, carpal tunnel syndrome. So what is Tinel sign? So Tinel sign is nothing but when for example, you are treating a patient with carpal tunnel syndrome. So what you will do, you need to ask the patient for keep their arm, okay. So four fingers and fifth finger, okay. This is the hand of the patient. So you need to tap on the anterior portion of the wrist. Okay, so if you tap here, what will happen? The tingling or the shaking of the fingers we can observe. So this sign is known as the Tinel sign. So this sign is positive in the case of carpal tunnel syndrome. So the next question is, what is hiatal hernia? Hiatal hernia is nothing but it is a herniation of the, otherwise protrusion of the one part of the, okay, this is the stomach. So we have the diaphragm here. So hiatal hernia is a protrusion of the end part of the esophagus. Okay, so this type of protrusion is called hiatal hernia. And the next one is what is diverticulum? So diverticulum is nothing but, for example, it may be the intestinal diverticulum. Okay, so for example, it may be the intestine. So what will happen in the condition? The diverticulum is nothing but it is like a bump. Okay, it's like a bump will come over the surface of the intestine. Okay, wherever. Okay, so this kind of bumps we can see over the intestine. So this is called diverticulum. Okay, so this kind of structures we can see on the even esophagus. So that is called esophageal diverticulum. So when this diverticulum has infected, this one is known as a diverticulitis. Okay, so this is diverticulitis. So the next one is a normal portal vein pressure. Options are 5 to 10 mm of Hg, 10 to 15 mm of Hg, 2 to 8 mm of Hg, 15 mm of Hg. So the right one is option A, 5 to 10 mm of Hg, portal vein blood pressure. The next one is Cullen sign seen in. So in which condition we can see Cullen sign? Pancreatitis, hemorrhagic pancreatitis, splenectomy, ulcerative colitis. The right one is option B, hemorrhagic pancreatitis. So in this condition we can see the Cullen sign. Most of the iron absorption is taking place in stomach, duodenum, large intestine, small intestine. The right one is option B, duodenum. So in the duodenum, most of the iron is absorption is taking place in the duodenum. It is a part of the small intestine. The next one is McBurney point. So McBurney point is nothing but, so we have the regions over the abdomen. Okay. So upper, middle and lower. So it is about the right lower quadrant. So this McBurney point is seen in the appendicitis. So this is called McBurney point. And the next one is cage questionnaire. So cage questionnaire is used for the patients with alcohol. Okay, and the next one is a melena is a occult blood. It is present in the stool. So when the patient is having the internal bleeding, so what will happen, the blood which is present in the stool, it is known as a occult blood. So it is also known as melena. The stool's name is a melena. The dead blood is present in the stool is known as a occult blood. The next one is Gray Turner sign and Cullen sign seen in the pancreatitis. Cullen. The next one is invertogram is one of the diagnostic tests for. So what is the use of invertogram? Options are pyloric stenosis, intussusception, anorectal anomalies, diverticulum. The right one is option C. To find out the anorectal anomalies, we can go for the invertogram diagnostic method. The next one is the most common site for occurring of peptic ulcer in stomach. Pyloric portion, that is pyloric portion, cardiac portion, esophageal junction, body of the stomach. The right one is option A, pyloric portion. So pyloric portion over here. So most of the ulcers are peptic ulcers we can find in the pyloric portion of the stomach. Next one is common site for stress induced gastric ulcer. Options are greater curvature, antrum, lesser curvature, anywhere in the stomach. So the right one is option D. Anywhere in the stomach it can cause the peptic ulcer by the common stress. Okay, stress, when the person is having the excessive stress and depression, so they may have the risk for the gastric ulcers. The next one is dumping syndrome is a complication of. Options are nephrectomy, subtotal gastrectomy, hysterectomy, ileostomy. The right one is option B, subtotal gastrectomy. So in this condition, the patient is having the dumping syndrome. So what is the meaning of dumping syndrome? So dumping syndrome. So in this condition, the patient will have the different kind of the clinical features like a diarrhea, vomiting, and feeling light-headed or otherwise tired after eating the food. Okay, so they have the a small. I mean, the normal structure of the stomach will be here. Okay, so in this gastrectomy, they will cut some part of the stomach. So what will happen? So stomach will become very small. So when the person is taking the food, what will happen? The patient feel tired, otherwise some kind of discomfort when they eat the food. So this is called dumping syndrome. So this is end of my class, guys. I will come after collecting some of the questions. Thank you for watching.